Hi everybody, I am Kalaivani Vetrivil, Department of Pharmacy and working as an Assistant Professor in SNS College of Pharmacy and Health Science. Today let's see a case presentation on Thalesemia. So what is Thalesemia? Thalassemia is a blood disorder passed down through families in which the body makes an abnormal form of hemoglobin. The disorder results in excessive destruction of red blood cells which leads to anemia. What is sickle cell thalassemia? Sickle cell thalassemia is a disorder that affects the shape and functions of the red blood cell. This disorder produces a normal hemoglobin that causes the red blood cells to change from a soft, round shape to hard, crescent or sickle shape when they give off oxygen. And see the red blood cells. The normal red blood cell will be in a this shape, and the sickle cell will be having some other shape other than the round shape. So, types of thalassemias: alpha thalassemia and beta thalassemia. Beta thalassemias are inherited disorders that result in the decreased synthesis or complete absence of the beta globin chains of hemoglobin. Alpha thalassemia occurs when the gene that controls the making of alpha globins. So, what are the symptoms? Fatigue, weakness, or shortness of breath, a pale appearance or a yellow color to the skin, jaundice, irritability, deformities of the facial bones, slow growth, a swollen abdomen, dark urine, etc. And what about the pathophysiology? The beta globin gene is a part of a cluster of genes located on chromosome 11. Its expression is regulated by an upstream locus control region, that is LCR. A variety of mutations in the gene or its regulatory elements cause defects in the initiation or termination of transcription, abnormal RNA splicing or cleavage substitutions, and frame shifts. The result is decreased or absent production of beta globin chains, giving rise to the beta thalassemia syndromes. And coming to the epidemiology, the beta form of thalassemia is particularly prevalent among Mediterranean peoples. In Europe, highest concentration of the disease are found in Greece. It is found in population living in Africa, the Americas, and also in Taru in the Terai region of Nepal and India. The highest incidence of thalassemia in the world with a carrier rate of 18% of the population. The estimated prevalence is 16% in people from Cyprus, 1% in Thailand, and 3 to 8% of populations in 8 to 3 to 8. Complications: iron overload. People with thalassemia can get an overload of iron in their bodies either from the disease itself or from frequent blood transfusion. Infection: people with thalassemia have an increased risk of infection. This is especially true if the spleen has been removed. Bone deformators. Thalassemia can make the bone marrow expand, which causes bones to widen. This can result in abnormal bone structure. An enlarged spleen, that is splenomegaly. The spleen helps your body fight infection and filter unwanted materials such as old or damaged blood cells. Thalassemia is often accompanied by the destruction of a large number of red blood cells, making your spleen work harder than normal, causing it to enlarge. Heart problems such as congestive heart failure and abnormal heart rhythms, arrhythmias, may be associated with severe thalassemia. And how come the diagnosis? The diagnosis of thalassemia major includes low RBC and hemoglobin levels. Laboratory tests also reveal elevated bilirubin and urinary and fecal urobilinogen levels, moderately increased fetal hemoglobin level on quantitative hemoglobin studies. An elevation of HbA2 demonstrated by electrophoresis or column chromatography confirms the diagnosis of beta thalassemia trait. And coming to the treatment point, treatment of thalassemia major is essentially supportive. Infections require prompt treatment with appropriate antibiotics. Doctors also might recommend a folic acid supplement for patients with moderate cases of anemia to help boost production of new red blood cells. Splenectomy and bone marrow transplantation have been tried, but their effectiveness hasn't been confirmed. What is neurogenic bladder? Neurogenic bladder refers to dysfunction of the urinary bladder due to disease of the central nervous system or peripheral nerves involved in the control of micturition urination. And what causes neurogenic bladder? Diabetes, acute infection, accidents that cause trauma to the brain or spinal cord, genetic nerve problems, heavy metal poisoning. What are the complications of neurogenic bladder? Urine leakage, urine retention, damage to the tiny blood cells in the kidney, infection of the bladder or ureters. And what is cholelithiasis? Refers to the presence of gallstones in the bladder. And what causes it? Cholelithiasis is caused by excessive amounts of cholesterol in the bile that is stored in the gallbladder. Cholesterol hardens to form stone-like substance from gallstones develop because the bile contains too much bilirubin. Bilirubin, a waste product of the liver that is component of the bile. And what about the risk factors? Older than 60 years old, and women between 20 to 60 old, and women with high estrogen levels due to pregnancy, oral contraceptive use or hormone replacement therapy, obesity, race, diabetes, rapid weight loss, fostering insulin. And coming to the case study, let's see, a 27-year-old male patient was admitted in KMCH hospital on 23 body pain, and his BP was somewhat low, pallor, and past medical history cholelithiasis, past medication history nil, and family and social history unmarried, non-veg. And see about his physical examination, that is temperature is normal, pulse is okay, BP is somewhat okay, fluid intake and fluid output, that is also okay. Laboratory examination, HB is very low, and other investigations have been identified. See about his complete blood count and special test at ultrasound scan of abdomen, hepatosplenomegaly, megaly and significant post-void residue. Final diagnosis, sickle beta plus thalassemia, neurogenic bladder, cholelithiasis. And so drug therapy regimen, capsule hydroxyurea 500 mg BD was given, Folvite 5 mg OD was given, and injection levoflox, that is 100 ml IV BD have been given. Tablet Alpho 10 mg HS is given, and injection tramadol 50 mg IV, that is SOS. And seeing about hydroxyurea causes macrocytosis, which may mask development of folic acid deficiency, correct severe anemia prior to initiating hydroxyurea therapy. Cutaneous vasculitic toxicities, including vasculitic ulcerations and gangrene, reported in patients with myeloproliferative disorders and receiving interferon therapy. Elderly person increased sensitivity to effects, renal impairment, initial dose reduction required. HIV infected patients, hepatotoxicity, hepatic failure, pancreatic, some fatal and severe peripheral neuropathy have been reported. And ADR is myelosuppression, dermatologic gangrenous disorder, skin cancer, hematologic genetic mutation, secondary leukemia. And what about alpha carcinoma of the prostate? Rule out prior to initiating therapy. Concomitant use with the other alpha blockers. Use is not recommended. Coronary insufficiency, risk of new or worsening angina pectoris, OT prolongation acquired or congenital, renal impairment severe, increased systemic exposure. And coming to the ADR, cardiovascular, atrial fibrillation, palpitations, prolonged QT interval syncope, dermatologic angioedema, dermatomyositis, hepatic hepatitis, and hepatotoxicity, ophthalmic intraoperative floppy, iris syndrome, reproductive priapism. And folic acid precautions is folic acid doses above 0.1 mg per day may obscure pernicious anemia, hematologic remission while neurological manifestation progress. Pernicious anemia and other megaloblastic anemia caused by vitamin B12 deficiency, and ADR immunologic allergy. And levofloxacin precautions on myasthenia gravis may exacerbate muscle weakness, ventilatory support requirement, and death have been reported. CNS disorders, example epilepsy, known or suspected, may increase risk of seizures or costs. Toxic psychosis discontinue if occurs. CNS have been reported. Diabetic patients, especially patients receiving oral hypoglycemic agents or insulin, may cause hyperglycemia. Hepatotoxicity, including acute hepatitis and fatal causes, have been reported. And cardiovascular, and about ADR, cardiovascular cardiac arrest, prolonged QT interval, dermatologic erythema, and multiform Stevens-Johnson syndrome, endocrine metabolic hypoglycemia, hepatic hepatitis, hematologic aplastic anemia, pancocytopenia, thrombocytopenia, and neurologic seizure, ophthalmic retinal detachment, renal acute renal failure. And tramadol Precautions are abdominal conditions, acute clinical course may be obscured. Abrupt discontinuation may induce withdrawal symptoms. Concomitant use of alcohol should be avoided. Renal impairment, respiratory depression, anaphylactic reaction, including serious and rarely fatal reaction, often following the first dose, have been reported. ADR, cardiovascular, myocardial infarction, gastrointestinal pancreatitis, neurologic seizure, respiratory dyspnea, depression. And farm notes findings: Palar icterius, HB, HbA2, HbF, HbS, TC, PCV, everything was found to be a normal. And also T bilirubin, indirect bilirubin, direct bilirubin, SGOT, SGPT, and LDH were found to be abnormal. Hepatosplenomegaly and significant post void residue. And assessment was 27. Old patient, means old male patient, was admitted with a bone pain, and all his means HB, HbS, everything was to be abnormal, and bilirubin is also abnormal. Sickle, hepato splenomegaly and post-void residue, neurogenic bladder, sickle cell beta plus thalassemia, and cholelithiasis have been found. Resolution: maintain a healthy weight, maintain a proper hygiene to take complete bed rest, maintain low fat diet, eat plenty of fruits and vegetables, drink plenty of fluid, avoid getting cold, treat infections and fevers quickly, see a doctor quickly if you feel unwell. The tablet Alfu should be taken after food, and exercise regularly, avoid rapid weight loss diets. And what about the monitoring? Monitoring of HBTC, bilirubin, SGOT, and SGPT. Discharge medications: hydroxyurea 500 mg for 1 month, and folvite, that is BD, and folvite OD 5 mg 1 month. Alfu, this is also 10 mg for 1 month, should be followed. That's all. Thank you.